నా పేరు బొబ్బిలి నరసింహారెడ్డి. నేను టీఎస్ఆర్టీసీ రాణిగంజ్ డిపోలో సీనియర్ అసిస్టెంట్గా పనిచేస్తాను. డిసెంబర్ మాసంలో నాకు హై బీపీతో నా యొక్క మెడలు నొప్పులు పెట్టి మొత్తం అసలు విపరీతమైన పరిస్థితి ఉండే. మా దగ్గరలో ఉన్న హాస్పిటల్కి వెళ్ళాను. హాస్పిటల్ వాళ్ళు పరీక్షించి వాళ్ళు చూసి వాళ్ళతో కాదని చెప్పేసి యశోద హాస్పిటల్కి వెళ్ళమని చెప్పారు. మలక్పేటలో ఉన్న యశోద హాస్పిటల్కి వెళ్ళాను నేను. అది ఇంతకుముందు నేను మా నాన్నకు కూడా ట్రీట్మెంట్ తీయించుకున్నాను అక్కడికి వెళ్ళిన తర్వాత నాకు అప్పుడు పొజిషన్ బాగా క్రిటికల్గా ఉండే. సూరిశెట్టి భరత్ కుమార్ గారు ఫిజిషియన్, వారు పరీక్షించి ఇక్కడ యశోదలో ఐసీయూలో ఉంచి ట్రీట్మెంట్ చేశారు. దాదాపు 15 రోజులు హాస్పిటల్లో ఉన్నాను. మంచిగా ట్రీట్మెంట్ చేశారు. ప్రస్తుతానికి నేను చాలా బాగా ఉన్నాను. ఇప్పుడు ఇంకా మంచిగా నయమైంది. సూచన మేరకు మందులు వాడుతున్నాను. దాదాపుగా మంచి క్యూర్ అయింది. ఇక్కడ ఉన్న స్టాఫ్ వీళ్ళందరూ మంచి కోఆపరేషన్ చేశారు. ప్రతి టైంకు వారి సర్వీసెస్ అవన్నీ చాలా బాగున్నాయి. హాస్పిటల్లో అన్ని ఫెసిలిటీస్ అవన్నీ బాగున్నాయి. థ్యాంక్ యూ.
Hello everyone, I am Dr. Sankit Kulkarni, intervention radiologist at Yashoda Hospitals, Malakpet. I am going to speak about a 56-year-old male patient by the name Narsimha Reddy that came to us with sudden onset headache. On scans, CT, MR and angiography, we found that he had a subarachnoid bleed, that is bleed on the surface of the brain due to a intracranial aneurysm. The intracranial aneurysms are balloon-like dilatations in the blood vessels that we see that can happen anywhere in the body. It is more dangerous if it happens in the brain because any bleed in the brain can be life-threatening. On evaluation of Mr. Narsimha Reddy, we found that this aneurysm was in a dangerous area called the basilar artery with an underlying congenital blood vessel abnormality called fenestration. In this, a normal blood vessel splits into two parts and joins again. This creates a weak point that can lead to aneurysms and strokes even without any comorbidities like hypertension or blood pressure. Here, when presented to us immediately after the bleed, we promptly evaluated and planned with the team of neurophysicians and neurosurgeons. We did a multidisciplinary discussion and planned for an endovascular, that is intervention radiological treatment for him, in which without an open brain surgery, we did a flow diverter assisted coil embolization of this aneurysm. Here we put a flow diverter stent in the main fenestrated artery, and then using that as an assistance, we put few coils to close off the aneurysm. The patient tolerated the procedure well. Post that we managed him medically for the previous pre-existing bleed for a few days in ICU. Then we shifted out. He made a very excellent recovery with no residual deficit. This is to create an awareness that anyone, whether they are hypertensive or smoking or even with a family history of similar kind of aneurysms, are at a higher risk for such bleeds. They need to be on good screening protocols, and whenever they have a very intense kind of headache, many times associated with seizures, vomiting or consciousness loss, are always suspected to have these kind of aneurysmal bleeds. Prompt evaluations and early treatment with good care, more than half of them have excellent outcomes. With poor management, these can be very life-threatening or can have very big disabilities. So it is always better to seek prompt care and get an optimal treatment. Thank you.
Hello, I am Dr. Surisetti Bharat Kumar, consultant neurophysician at Yashoda Hospital, Malakpet, Hyderabad. We came across a patient by name Narsimha Reddy, who is a 56-year-old gentleman suffering from severe intolerable headache which was not responding to any medications. Here we did a CT scan and followed by MRI digital subtraction angiography, that is nothing but an angiogram, which showed that he was suffering from a aneurysm. Aneurysm is nothing but a blood vessel that will have an outpouching from one of the walls. So it is the weakest area in the blood vessel which got ruptured, and he had a bleeding from that area. So here, as it is in the brain stem, that is nothing but a critical area in one of the brain areas, so where surgery is almost impossible. So here we, along with the team of interventional neuroradiologist and also neurosurgeon, we collectively decided and we did a procedure called as Basilar Artery Aneurysm flow diverter. In that, it is like a stent in the blood vessel. So we put a stent and followed by aneurysm which was there, that was coil. So the patient underwent the procedure uneventfully, and he was completely alright during the post-operative period. So aneurysms, it is one of the most serious brain-related issue. So most of the patients, they present with very severe worst headache of their life, and they also have other symptoms like dizziness and imbalance while walking, and also they have stroke-like symptoms. If you have any of these symptoms, consult the doctor immediately and get it treated. Thank you.